I'm a medical doctor specialist in public health, and as Silke said, my role in the project is providing information and argument about health benefits of active transport. I will give a briefly introduction and go into more details within the workshops following. So I will just briefly point out why using health arguments, what are the benefits for you, for the stakeholders, for the target populations, whom to address and how to address the target groups, and how to link the health arguments to the specific target groups. The first question is, why using health arguments in promotion of active travel? What's the relation between health and active transport? The equations are quite simple. First, active transport is a part of health-enhancing physical activity, shortly said HEPA. And decrease in HEPA means an increase in non-communicable diseases, or shortly NCDs. And the consequence is, if we promote active travel, active transportation, we promote health-enhancing physical activity, and we increase health-enhancing physical activity and decrease the prevalence of non-communicable diseases. So what are the benefits? Our common goal within this project is reduce short car trips with walking or cycling. But the benefits, the more specific benefits, are different for you, for the stakeholders and the target groups when it comes to the collaboration with the public health sector and when using health arguments. What can you gain, you and your stakeholders gain from the collaboration with health institutions, especially with public health organizations? It's very important for you to strengthening the network for promotion of active transport, because we hope the Switch project won't be your last campaign for promoting active transport. And once you establish a strong network, you can gain from their knowledge and experience on the long term. So identify who can help you. I'm quite sure they are at least some of health institutions in your local environment that you can rely on, that can provide you support, not only health arguments, not only health informations, but also the opportunity to collaborate with them. You can include them in your campaigns, but they can offer you the opportunity to join their campaigns. If they are more general health related or physical activity related, you can join with your active transport topic. Then, as I said, a long-term collaboration can benefit a lot. And you have to think, what can you do for each other? We learned already that using health arguments can be very beneficial for your campaigns, but you can also help the health sector in promoting physical activity. What are the benefits for the target population? Besides of reducing the car trips and the undoubtable huge effects on the environment, there are benefits for each individual's personal health and well-being. It's a motivation for a healthier lifestyle in general. Once people start thinking about changing a health-related behavior, it can act like a snowball. They change one behavior and then they start thinking about changing another health-related behavior. Simultaneously, you raise awareness about the importance of physical activity for health, because, as I said, active transportation is health-enhancing physical activity. And one big benefit, a very important main result, is improving or maintaining health. And not only physical health, we mean more all over well-being. And it's also strongly related to the environmental health. So we are improving not only individuals' health, but also the health of the population, of our environmental in general. within your campaigns, you have to work with stakeholders and target populations. You need the stakeholders to support you, to facilitate, to multiply your work, your campaigns, and you need to work with your target population to get a more direct effect. Who are your stakeholders? I named only a few of them, but each one of you will identify at least one or more others. The most important are, of course, the communities where you will conduct your campaigns. Then regarding to the target groups you will address, there are the schools and kindergartens, the health institutions, urban planners, NGOs, and not forget the media. Especially the media are a very important and strong partner. They can support you a lot, they can facilitate a lot, and you should take advantage of them. The target groups, you can see here they are more than were identified from the beginning. The target groups of the Switch project are mainly school children, pupils, then employees, and people received medical advice. Why are they here counted more of them? Because if you want to reach your specific target group, you have to work with groups related to them as well. If you want to affect employees, you have to include the employers as well. If you want to reach children, you cannot do it without including teachers and parents. If you target to patients, you also have to target the general populations, because everyone has a social environment, has a social network, and it's more beneficial if you work with a bigger population than with the specific target groups. It's very important to link the health argument accordingly the target population, the target group. There's a number of health informations, and they can be very general or very specific. And it's important that especially the specific informations are related to your target group you're working with. So if you are targeting the adult population, the working population, it's important to point out that use of active transportation can decrease absenteeism and can improve productivity. When addressing employers, don't forget to mention several cost-benefits analysis. And then also point out the benefits of individuals' health. Children, physical activity is very important for the children's development, and with physical activity also active transportation. One thing is physical activity by itself. Our children are sitting more and more time, and any kind of physical activity is reducing the sitting time and improves their health. And not only physical health. Active transportation is important for their motorical and also psychosocial development. Teaching children to walk or cycle to school cannot only improve their health, but it's only beneficial for traffic education and knowledge about traffic safety. So walk with them. Tell the parents to walk or cycle with them, because it can only benefit their development. And last but not least, if you start raising awareness on environmental health as well in the younger stage in children, you will raise a responsible adult who will take care not only for his own health, but only for the health of the environment and general population. The patients might look like a difficult target group. They have some specific needs, but addressing them is important. And if we add to the patients also the elderly populations, we have a target group which will grow every day. And with them, we have to point out the benefits for their individual health. It's always good to relate the benefits of physical activity to prevent or manage non-communicable diseases. Then point out the relation between active transportation and exercise, because a lot of people relate physical activity only to sports and exercise, and it's important to know that physical activity, especially health-enhancing physical activity, is way more. That also active transportation can mean physical activity for health, and especially in patients and elderly people, which are often limited in doing recreational activities or sports. Active transportation can be an important aspect to keep them moving and maintaining their health. But we also have in mind that they have possible limitations and restrictions and need to address them as well. When addressing the general population, you can use more overall aspects, more overall arguments, like importance of regular physical activity. Then again, explaining that active transportation can be health-enhancing physical activity. Then also point out that active transport can be a time-saving exercise if there's a lack of time for doing anything else. And also don't forget the environmental aspect, because environmental health is at least as important as our individual health. How to reach your target groups? The adult working population you can reach either directly or through the employers. That might be a very good way, because if you have the commitment of the employers, your activity can be more effective and easier to conduct. And also through the media, if you want to reach a bigger population and not only one specific organization. If you work with children, you cannot do it without including the school, their teachers, and of course the parents. In bigger children, in bigger pupils or students, you can also use the direct approach, but when targeting pupils, students, it's always beneficial to target the organization, the school first. Patients, you can reach them through the doctors, nurses, or other health professionals. Use the clinic waiting rooms to spread your information, spread your materials, and also use the media. And with media, I mean look for specific websites, newsletters or magazines that are targeted to patients or specific diseases, because on this way you can reach them more effectively. And the last thing, always have in mind that health information you are giving always should be clear, simple, verified, and tailored. By clear and simple, I mean the main message, the introductional messages. For example, Wiebke showed on this postcard. Especially the first messages needs to be clear and simple. So a short, only one sentence with a simple and clear message, like 30 minutes of physical activity daily benefits your health, or cycling to work is health-enhancing physical activity. By verified, I mean work also with the health institutions, because they can provide you reliable and verified health informations. And tailored means that you use specific information for specific target groups. You have some materials available on the Switch website already. Use them, they can help and support your activities. And of course, for more detailed information, for more detailed guidelines, we can talk about them within the workshops following. And I think my address is also included in the materials, so you can, of course, contact me for more detailed information. Thank you very much.